This is an audiovisual representation of a study published in the Journal of Bone and Joint Surgery in 2022. Patients who undergo total knee arthroplasty, or TKA, frequently report feeling dissatisfied with the results despite good clinical outcomes. One of the hypothesized contributors to patient dissatisfaction is the trauma of surgery. Robotic-Arm-Assisted TKA has been associated with a transient reduction of the early systemic inflammatory response, as well as bone and soft tissue trauma, but there is no information on whether any differences are evident with respect to the local inflammatory response compared with conventional TKA. A group of researchers conducted a prospective randomized controlled trial on 30 patients with knee osteoarthritis assigned to either robotic or conventional TKA to understand how differences in inflammatory responses could influence postoperative recovery. They measured local inflammatory markers via fluid from an intra-articular drain in both patient groups at 6 and 24 hours following surgery. They found that patients who underwent robotic TKA had lower levels of interleukin or IL-6 at 6 and 24 hours and IL-8 at 6 hours. The robotic TKA group also had lower pain scores on days 1, 2, and 7 after surgery. Patient-reported outcome measures, or PROMs, were comparable between the two groups at 2 years. However, owing to the sample size, the study was underpowered to identify any statistically significant differences in PROMs. Additionally, the researchers observed significant correlations between all serum markers except IL-1B and self-reported pain on day 7. A moderate correlation between IL-6, IL-8, and tumor necrosis factor alpha levels at 6 hours and knee flexion or extension was observed as well. These findings indicate that robotic TKA is associated with a reduction in the early postoperative local inflammatory response, and that the early local and systemic inflammatory responses are correlated to pain and early functional outcomes. Further validating these findings in larger studies with longer-term data will be essential to optimizing TKA procedures.